This video is a compilation of lessons of wisdom learned by the authors over a period of time. Our first lesson is that thoughtfulness breeds ideas and ideas breed solutions. The classic example of this is a 70 years old male patient with bilateral proliferative diabetic retinopathy and vitreous hemorrhage who had severe kyphosis and was unable to carry out his routine activities without support. His kyphosis posed a major challenge for us to perform a meticulous vitreoretina surgery in a routine OT setup, and we thought a lot for all possible solutions. The first thing we did was to tilt the OT table and give extra cushion to support the patient's neck. However, the first issue with this setup was the increased height of the surgical plane, and a routine OT chair or standing position were not visible. So we decided to use a high chair from our optical shop as our OT chair. The immediate second issue, however, was the inability to operate the 4 footpad controls, for which we took 2 metal stools and placed the footpads on them to facilitate their smooth operation. The third issue faced was the presence of residual tilt of the neck, making a superior routine vitrectomy difficult. We therefore shifted the setup from a superior to a temporal vitrectomy, which ensured least disturbance from the residual tilt. The problem of lack of wheels in the chair was managed by wrapping a cloth around the chair for pulling it. Let us have a look at the execution. As we can see here, cloths were used to provide cushion to the neck and the OT table was tilted. Once the surgeon was seated, the chair was pulled with the help of the wrapped cloth and adjusted to the final position. The footpad controls were checked and temporal vitrectomy was started with all due care. The temporal position did require active adjustments from the operating surgeon. However, the basic principles of diabetic vitrectomy remained the same, and with meticulous handling of the membranes in a careful and a much more comfortable manner compared to how difficult and taxing a vitrectomy in standing position could have been, the case could be successfully completed in both eyes and the patient gained good ambulatory vision. Our next lesson is that mysteries get solved when history is acknowledged. The first example is that of a 26 years old male who presented to us with traumatic endophthalmitis of left eye and gave history of taking bath in a pond when suddenly a fish came and bit his left eye. It was a period of COVID lockdown and the limited investigations done did not reveal any intraocular foreign body. However, a thorough exploration was done in accordance with patient's history and a cartilaginous fish skeleton was removed from paralimbal area measuring 4.5 mm, and this case was reported in a reputed national journal in 2023. The second example is of a 48 years old female who had recurrent retinal detachment and finally had a successfully attached retina after 4th surgery. She, however, kept complaining of persistent floaters, and acknowledging the severity of her complaints, we asked her to draw her floaters one day. It was then that we realized that the patient actually saw creatures of various shapes which kept changing their appearance and were associated with tactile and auditory sensations too, and she even saw the creatures move on people's head. We therefore referred her for a psychiatric consultation where, on detailed and regular evaluation, she was found to have psychosis and delusional parasitosis and was put on antipsychotic medications, following which the patient's floaters are now fading away. The next lesson is that the most certain way to succeed is to keep trying. The example is a 17 years old male who underwent bilateral SFIL implantation with plus 30 diopter 3-piece foldable IOL but developed repeated decentrations in his left eye. His decentered SFIL was retugged not once, not twice, but 3 times before it finally stabilized, and the patient has been able to maintain 6/9 vision for more than a year now, highlighting the importance of perseverance in the life of a surgeon. The last lesson is that if we can't heal an ailment, we can still heal the soul. The example of it is a 70-year-old male patient who was referred as a simple case of nucleus drop. However, on presentation had developed pseudomonas positive endophthalmitis. The patient underwent core vitrectomy and pars plana lensectomy, but following which there was an unfortunate development of retinal detachment and its surgery was done, resulting in multiple surgeries, prolonged recovery period and limited outcome. The entire period was a disappointment for the operating surgeon, but he tried his best to be empathetic to the patient and gave him the best possible outcome, which resulted in a thankful and satisfied patient even with the limited outcome. Thank you for watching our video. We hope our pearls of wisdom are found useful by the audience.